Go ahead.
The national vaccination mandate.
Before we discuss the national vaccination mandate, it's important to understand the background of this issue. Currently, all 50 states have some form of a vaccination mandate, but most of these are easily circumnavigated by a signed document from a religious official. And because of this, we're seeing an increased amount of exemptions from vaccinations and thus an increase in outbreaks. According to the CDC, there were recently 2 measles outbreaks in the Pacific Coast. One in 2014 originating from Disneyland, California, and one in 2018 originating from Washington. And because there's more and more outbreaks, it must be determined if the United States government should mandate vaccines for all medically able civilians. And we define medically able as people who would not have an adverse side effect from receiving a vaccine.
First of the 3 solutions our group proposed was that a national vaccine mandate should be imposed for all medically able citizens. Our second solution was that only a mandate should be imposed for minors in school who are more prone to risk. And furthermore, our last solution was that there should be no national vaccine mandate for the country.
So after compiling all of our research and analyzing multiple perspectives, we came to the group decision that there should be a vaccination mandate in the United States of America for all medically able persons.
And shown here, as according to the Centers for Disease Control, are the vaccinations that would be imposed as a result of this national vaccine mandate that we chose. So now to see the scientific facets of this issue. So in recent years, there have been numerous vaccine advancements for the greater health of our country. First and foremost is that it's well known that vaccination provides rapid protection against disease as people are exposed to the virus and then they're able to gain immunity from it. However, as according to the U.S. Department of Health and Human Services, a very real and probable concept for the United States to achieve is herd immunity. Herd immunity is where, with less prominence of a disease and more vaccination of the members of that society, people are essentially will not have to experience the risk of that disease anymore in their society. As such, if the United States can achieve this, it will be much better for the welfare of America overall. However, there are drawbacks with this issue. As first, there's medical preventions, as according to the National Journal for Engineering Sciences and Medicine, there was found a causal relationship between certain vaccinations and certain adverse effects, resulting in some patients not being able to take on that vaccination, and as a result, it's a case-by-case scenario. Also, there will be recurring diseases which will result in new mandates having been imposed in order to account for new outbreaks and viruses. So as you can see in this visual, used formatted from data collected by the University of North Carolina, is how great the effect vaccinations had on the welfare of America. On the left, you can see how high the risk and prevalence of certain diseases was, and on the right, you can see how far they've diminished, which is severely as a result of vaccination being imposed. And now, this is a chart from the Northern Rivers Vaccination Support Group showing how a vaccinated population will fare in times of crisis as compared to an unvaccinated one. And as you can clearly see on the left, there will be less death and more productivity in a community that is more vaccinated than one that's not. So now to see the implications and limitations scientifically of our mandate. So first and foremost, of course, there will be increased herd immunity, and this would be limited by the other solutions as they would not be covering all able people. As well with this would ultimately result in improved wellness and health for America overall. However, it is limited by the fact that adverse effects limit how number of patients we can actually mandate this vaccine for, as well as new outbreaks that would have to be continually imposed on for vaccination.
So moving on to the economic part of our solution, there would be a general timeline that would form if we were to pass a mandate like this. So for instance, if you were to vaccinate all children in the United States of America from the ages about 0 to 2, those children would have a markedly reduced chance of acquiring severe illnesses, as mentioned in the scientific lens. According to Dr. Monde Artoumi at the University of Aix-Marseille in France, he says that children with less severe illnesses are less of an economic burden on their parents because those parents don't have to pay for the cost of treatment. Now this chart here shows about the distribution of vaccine-preventable illnesses and how much it cost in 2015, accumulating to about $9 billion. That cost would be dramatically reduced if all children in the United States of America were vaccinated for vaccines. Coupled with this is data acquired from Statista shows that families with more money typically have lower birth rates. So now if you have families with lower birth rates combined with more money in their family, they actually have a stronger family economy. But not only is the family economy strengthened in America, but pharmaceutical companies as well. According to Michael Watson, the president of Valero, which is a division of Moderna, Moderna is a biotech company out of Cambridge, Massachusetts, he says that the vaccine ecosystem is on the decline due to lack of funding. Vaccine ecosystem essentially just being all the stakeholders involved within the pharmaceutical industry, and it'd be easily fixed by mandate because everyone's been being forced to buy these vaccines or the government's paying for it. And With that, according to Dr. Nisha Chandran at the Institute of Genomics and Integrated Biology in New Delhi, a good and functioning pharmaceutical industry can single-handedly bring up an entire country's economy, as shown with India in the past. So now if you have more economically stable families and an economically stable industry, the entire country as a whole becomes more economically sound. It is important, though, to recognize implications and limitations of a solution, one being that taxes or spending would increase depending on whether or not this was government funded. But it's countered by the fact that the cost of treatment is way higher than the cost of prevention, like vaccines. Another one is that pharmaceutical companies could take advantage of the newly found mandate and increase the price of vaccines, but that could easily be stopped by proper regulation on the government's part. One of the limitations is just the cost of vaccination could be within the billions of dollars to vaccinate the entire country and keep it going for generations. It is also important to acknowledge the pros and cons of other solutions. If we were to just mandate minors enrolled in school, it'd be less of a financial commitment up front, but it would only affect families with children enrolled in school, which is a smaller grouping of people. Now, if there would be no federal mandate for vaccine, there's absolutely no financial commitment up front because no one's required to buy it. But at the same time, you're losing that $9 billion a year to treatments. And not only that, but there's also potential collapse of the vaccine ecosystem in the United States of America.
Now that we've stated the economic side of this debate, it would be logical next to go to the political side, but first we have to discuss some social background. Currently, many different religious groups have varying degrees of opposition towards vaccines. For instance, the Roman Catholic Church opposes vaccines that involve cell lines that were created from voluntarily aborted baby fetuses, such as the hepatitis vaccine. Islamic beliefs are fairly similar in that they oppose vaccines that contain gelatin, such as the measles or mumps vaccine. Protestant beliefs, though, vary widely depending on the denomination or local religious leader. Many follow the example of the Church of Christ scientists, who do not favor vaccination but at the same time do not condemn their use. This plays into our political lens because it involves the First Amendment of the United States Constitution, which states that no government can prohibit the free exercise of any religion. If you force a Catholic man to accept a hepatitis vaccine, which involves cell lines that are created from voluntarily aborted baby fetuses, then you'd be infringing on that person's right to avoid such a vaccine. So in that sense, a national vaccination mandate would be unconstitutional. But before this renders our whole argument moot, we must take into account two legal precedents set by two important court cases, Henry Jacobson versus the Commonwealth of Massachusetts in 1905, and Prince versus the Commonwealth of Massachusetts in 1945. The former court case, ruled by the Supreme Court, found that any government can avoid a person's religious opposition if it is for the good of the community, and thus they can force vaccination. Similarly, Prince versus the Commonwealth of Massachusetts stated that vaccination can be forced upon a child if it is for the good of their own health, and they can avoid a parent's religious issues. This plays into our argument because if you take Henning Jacobson versus the Commonwealth of Massachusetts and combine that with the fact that our nation does not currently have herd immunity, meaning we are at risk to certain outbreaks, we can then make a national vaccination mandate constitutional because it would be to guarantee the health of everyone in the community and thus would be in line with Henning Jacobson versus the Commonwealth of Massachusetts. For the political lens, we have many different implications and limitations associated with every solution. For our solution that all able citizens will be vaccinated, an implication that would be vaccination would then become a federal issue, and that herd immunity would be achieved in America. Some limitations, though, is that there would be major social backlash from the religious community, and that religious rights in America would be severely limited. For our second solution, that all legal minors must be vaccinated, an implication would be that vaccination would also become a federal issue, but the minor community in America would then be secure and safe from disease. And a limitation, though, would that be parental rights in America would be severely limited, as well as there would be more backlash from the anti-vaccination community. For our third solution, no federal mandate must be implemented. An implication would be that the rights of a citizen would be untampered, but a limitation would be that we would have continued threats from outbreaks, like those in California.
So now that we have gone over all three of our lenses and looked at the evidence behind each lens, it's important to summarize why our solution works overall. To first discuss the drawbacks of our solution, one of the potential drawbacks is that there could be potential side effects for people who cannot medically accept a vaccine. The second one is just the cost of nationwide vaccination for many generations, again, could be within the billions of dollars. And the last drawback is that it could potentially compromise certain religious rights within the United States of America.
However, there are several benefits to be found with our solution. First and foremost is that the health and welfare of America would greatly increase as a result of this mandate. Furthermore, this would ultimately lead to greater economic productivity and improvement from this mandate. Furthermore, it would be constitutionally appropriate to impose a rule that allows for the better security and safety of America as a whole.
And so, weighing the pros and cons of our solution, as well as those of the other solutions, we uphold that a vaccination mandate in the United States should exist for all medically able citizens. Here's our work cited.
All right. Luke. Give one example why that, give one specific way that your thinking changed as a result of outlearning Yaya's findings.
So when I looked at Yaya's findings, especially about the whole idea of herd immunity and the fact that vaccination could result, and nationwide vaccination could result in herd immunity, it really qualified my arguments about economic benefits, because my whole economic benefits idea is that if people don't get sick as often, you're just going to make more money as a country as a whole. So I guess his argument more of, say, qualified and corroborated with my argument to make it stronger.
Okay. Cool. Describe an argument from one of your peers' individual reports that made you think differently about your team's solution.
Well, Luke's actual argument about the economics side of the debate, which was that if you put more money in the hands of the people and promote the vaccine industry, that the economy overall would then benefit, that really changed my mind on what solution we should choose. Because on my solution, there would be major social backlash from the solution we chose. But that is countered by the fact of Luke's economic argument, which otherwise we would have chosen the second solution.
Okay. And last, Yaya, having finished your project, what, if anything, do you consider to be a gap in your team's research? If addressed, would you feel more confident about your conclusion?
So after going through our research, we found that it would be better if we were able to specifically define medically able, as it is a case-by-case scenario in which it depends on the patients as well as what their certain health is. So as such, if we were able to better define that, it would be easier for us to make our presence more concise and conclusive for our argument.
Okay.